Today we're going to be talking about applications to the skin. Hi, I'm Kathy Getrust and I'm an instructor in community health. Warm and cold applications are used for a variety of reasons. They're only given with a written order from a physician and have a very specific period of time that they are to be applied. Some facilities only allow professional staff to apply heat and cold, and some states have laws against unlicensed staff, such as yourself, applying these treatments. In other facilities, caregivers who have been specially trained are permitted to carry out these procedures under the supervision of the nurse. Given these differences, be sure that you are aware of the policy in your facility and are adequately prepared and supervised before doing any of these independently. There are a number of reasons why warm and cold is applied to the skin. One might be to relieve pain, to combat local infection, swelling, or inflammation. They might be used to control bleeding, alter the body temperature, or to reduce joint stiffness and help relax the muscles. There's a difference between dry and moist applications. A dry application means that no water actually touches the skin. It's just the heat or cold that touches the skin. A moist application is an application where water does touch the skin. And this makes water, the water addition makes the cool and warm applications much more penetrating and much more likely to cause injury. So extra care must be taken to protect the patient when moisture is used. There are high-risk groups that receive warm and cold applications that need particularly close supervision. I'm thinking about young children that may not be able to report that they are experiencing any problems. Older adults, on other videotapes we've talked about older adults having decreased sensation on their skin. Sometimes patients that have mental impairments or cognitive impairments may not be able to report that there's a problem with the warm or cold application. Patients who are unconscious and are totally unaware of the environment around them would not be able to let you know if there was a problem. People who are paralyzed, I'm thinking about someone that is paralyzed from the waist down and they're going to be having an application put on. They have no sensation in those legs when they're paralyzed, and as a result you'd have to take special care to be aware of problems if they were occurring. And also people who have poor circulation. Diabetics frequently have decreased sensation in their legs and may not be able to report a problem if it occurred. Cold applications are only given with a physician order, and a number of reasons why cold would be applied. One is that it constricts or decreases the size of blood vessels. This is called vasoconstriction. The vasoconstriction helps reduce any swelling that might be there. Maybe you're aware of a sports injury when might be an ankle sprain or something to that effect. Ice will be applied to help prevent that ankle from swelling. Cold can also decrease sensitivity to pain. Headaches, toothaches, maybe facial surgery. They'll apply cold to help relieve the pain from those things. Also, it can help reduce temperature. If someone has a very high temperature, I'm talking 105, 106 degrees, they will frequently use cold to help bring that temperature down. Also, cold is used to slow an inflammatory process where there's redness and swelling and pain. The inflammation can be reduced by the application of cold. Also, cold can help reduce itching. Sometimes a medicated bath of cool water with some particular medication applied to the water can be used for itching. Could be due to an allergic reaction where there's been quite a bit of rash developed as a result. Remember, moisture increases the effect of cold just as it does with heat, and so caution must be used when applying a moist cold. Excessive cold can damage body tissues, and so be sure that you report any color changes such as cyanosis. Cyanosis is a bluish color. It's easier to see usually on someone's lips if there is too cold application. Or there could be blanching. Blanching is another term that means turning white, or in a darker skinned individual, kind of a gray, maybe even a ruby red color can occur. So note any color changes. Report any feelings of numbness, tingling, or loss of sensation, or any other discomfort that you might be aware of. Stop the cold application if the patient starts to shiver. If someone starts to shiver, it really is counterproductive to be applying cold. The act of shivering increases body temperature, so you certainly do not want them to start to shiver, particularly if they have a high temperature, as it will only increase it more. In that instance, you would want to stop the cold application and cover the patient up so the shivering can stop and report it immediately. There are several methods for applying therapeutic cold. One might be the use of a disposable ice bag. These are single-use bags that are commercially prepared and can be stored until they're needed. They usually remain effective for about 15 to 30 minutes. Because there are a wide variety of these single-use packs, be certain to follow the manufacturer's instructions carefully because they all differ a little bit. You also might use an ice bag. An ice bag is a reusable, waterproof container that can be filled with ice, large pieces of ice or ice chips, and it will help provide temporary local cold. Sometimes you might see an ice bag that is used, a vinyl glove that you might use for standard precautions. Sometimes you'll have ice chips put into that vinyl glove and applied to the forehead or face if there's going to be surgery on the face, and you might have to use a vinyl glove for the cold application. Dry cold applications are never placed directly on an affected area. You must always cover them with a flannel piece of material, a towel, or other protective material. There's also moist cold applications. One might be a wet compress. A wet compress is moistened with a solution and placed on the affected area. The solution may, in addition to water, be alcohol. Alcohol evaporates very rapidly from the skin, and along with that evaporation of the alcohol is the evaporation of heat, and so it's particularly used when there is a high temperature on an individual and you want to get that temperature down quickly. A wet compress can be kept cold by placing a covered ice bag against the affected area. There are safe ranges for use of cold. If it's going to be what's termed a tepid cold application, tepid means lukewarm, that would be around 80 to 90 degrees Fahrenheit. And if you recall, the normal body temperature is 98.6. So this is just a little bit cooler than normal body temperature. Then a cool application would be about 65 to 80 degrees Fahrenheit, and then a cold application would be 50 to 65 degrees Fahrenheit. You won't have cold applied lower than that because it can do damage to the skin. Now I'd like you to watch a demonstration of applying a disposable cold pack. Wash your hands and assemble your equipment. Provide for privacy. Identify the patient and explain the procedure. Expose only the area to be treated, and notice the condition of the skin. Strike or squeeze the cold pack and shake it vigorously to activate the chemicals. Be certain to follow the manufacturer's instructions specifically. Place the ice pack in a cloth covering. Place the covered cold pack on the proper area and cover with a towel. Note the time of application. Secure the cover with tape or gauze if necessary to hold it in place securely. Leave the patient in a comfortable position with the signal cord within easy reach. Return to the bedside every 10 minutes. Check the area being treated for discoloration or numbness. If these signs and symptoms occur, discontinue the treatment and report them to the nurse. If no adverse symptoms occur, remove the pack in 30 minutes or after the amount of time given in your instructions. Note the condition of the skin. Remove the pack from the cover and discard it according to your facility policy. Make the patient comfortable and wash your hands. As with cold applications, warm applications are only done with a physician order. There are a number of uses for heat. Some might be to relieve muscle spasms. If a person has a strained back, they might be using heat to help relax those muscles. Also, heat can reduce pain, provide some soothing warmth. Sometimes if a person has had rectal surgery, hemorrhoid surgery, something like that, it helps to use warm water to relieve some of the pain. Also, warmth can dilate or increase the size of blood vessels. That's called vasodilation. This vasodilation helps bring the blood vessels closer to the surface, and that provides nutrients that are brought along in the blood and oxygen and can remove waste products. Another reason why heat might be used is to combat local infections by helping remove harmful wastes. And it improves the mobility of an individual before exercise periods. Sometimes if a person is going to physical therapy, they have rheumatoid arthritis, very stiff joints, the warmth can help loosen those, relax those joints a little bit so that the physical therapy is more productive. Moisture increases the effect of warmth because water conducts heat, and heat penetrates deeper with moisture, and so to prevent injury, the temperature of moist heat must be lower than it is with dry heat. Never allow an individual to lie on a constant heat unit because heat can be trapped and build up to a dangerous level. We had an experience several years ago in our area where it was reported a young mother had a fussy child. The child seemed to be cold, and out of frustration and all, she wrapped this little infant in an electric blanket in an effort to soothe her and keep her warm. She quieted down, but when the mother came later, the child had died. When the emergency room saw her, her temperature was 110 degrees Fahrenheit, and it was a very sad reminder of the hazards that can take place when wrapping somebody in a heat blanket or even having them lie on it, particularly folks that may not be able to report problems. Always use a bath thermometer to check the water temperature to make sure that it's within a safe range. And always remove a body part before applying water. So if, for example, you're going to be soaking a foot, take that foot out before putting fresh, warm water in. Warmth is not applied to the head because it could cause blood vessels to dilate and result in quite a severe headache. Rubber or plastic should never touch a patient's skin directly. Be sure that all applications are covered with some type of cloth. Observe the skin for signals of complications. Immediately report to the nurse any pain, numbness, or burning sensation, any excessive redness, or a blistering that you might see on the skin. There are safe ranges for the application of warmth. A warm application is between 90 and 100 degrees Fahrenheit. Hot is between 100 and 105 degrees Fahrenheit, and very hot would be 105 to 115. Above this can cause burning, and so you would not use any temperature above 115 degrees Fahrenheit. There are several methods for applying warm, dry applications. One is the use of an Aqua K pad. This consists of a plastic pad with fluid-filled coils and a control unit that maintains a constant temperature of the fluid in it. Electric pads are also used in facilities. However, if a patient brings one in from home or a family member brings in from home, that should be reported to the nurse because most instances they are not permitted to be brought in. They must be purchased by the facility and used there. And the reason for that is sometimes patients may bring in electric blankets or heating pads that have frayed electrical cords and could cause fire hazard. Another kind of warm application would be a gel pack. The risk of burning is less than with moist heat because the dry heat does not penetrate as deeply, and also because water which conducts heat is not involved with a dry, warm application. Remember, moisture does intensify heat, and you must use extra care. For each of the warm treatments, follow your facility's policy very carefully for the length of time the treatment is to be applied, how often the patient needs to be checked for the condition of their skin, and any signs that the treatment should be discontinued. Warm, moist application could be a warm soak. This is where the patient's whole body or just a part of the patient's body that's being treated is immersed in a tub that's been filled with water at a specific temperature, usually about 105 degrees. A foot soak might be a type of warm soak that's used for maybe an ingrown toenail, or something called a sitz bath may be used where an individual sits in their bottom, actually their rectal area sits in a warm basin of water, and that's used for rectal surgery patients, or it might be following the delivery of a baby. It provides a relief of pain and soothing warmth to the area. Another application might be a wet compress. That consists of a washcloth or a small towel or gauze dressing that's soaked with water. There are sterile and non-sterile compresses. Sterile applications are used when there has been open wound, and because it's an open situation, is performed only by the nurse. Now I'd like you to watch a demonstration of applying a moist, warm compress. Wash your hands and assemble your equipment. Identify the patient and explain the procedure. Provide for privacy. Expose only the area to be treated. Note the condition of the skin. Place a bed protector under the body part. Fill the basin 1/2 to 2/3 full with hot water. The water temperature should be 105 to 115 degrees. Use a bath thermometer to verify. Place the compress in the water. Wring it out. Apply the compress to the affected area. Cover the compress quickly with a bath towel followed by a plastic wrap, or use an Aqua-K pad. Note the time. Place the call light within easy reach of the patient. Check the area every 5 minutes. Note any redness, complaint of pain, numbness, burning sensation, or other discomfort. Remove the compress immediately if any occur and report to the nurse. Remove the compress after 20 minutes or as directed by the nurse. Pat the area dry with a towel and assist the patient to a comfortable position. Return the equipment to its appropriate area and wash your hands.